first of all, a very, very big thank you to the family for making this trip possible and giving me the opportunity to come across and share this knowledge with you, because nobody here probably knows a lot about new vision therapy or NVT. My background originally is engineering. I was a mechanical engineer, and I got involved in the crazy world of bodywork because I had a shoulder problem for the best part of 10 years, which nobody could help me with. I'd been to the hospital, I'd had scans, I'd had x-rays, I was seeing physios, chiropractors, osteopaths. It was always the same. Whoever I saw for my shoulder pain, it felt great for 2 days, and then on the third day, the pain was always back. In the hospital, after 18 months of physio, I was basically told that I was imagining the pain. Because they couldn't find anything physical with the scans or the x-rays, they said, look, we think the pain is in your mind. We don't actually believe you're in pain, we think you're imagining it. And I remember standing in the physio room, I had my t-shirt off, I had a very physical job, so I had left muscles like Popeye, very good muscles on this side, but this side was down to the bone. I'd physically lost my trapezius muscle on one side. So I remember saying to the guys, hey look, I'm not here to waste my time or your time. This is physical, you can see it. And they did acknowledge that yes, there was an imbalance, but they had no idea what was causing the problem. So basically what they had was two options. They could either do what they called an exploratory surgery, which was to cut me open and have a look. Now that didn't appeal because they didn't find anything with the scans, the x-rays, etc. So for me, with my engineering mind on, to cut me open to have a look, it could make things worse, and they probably wouldn't find anything, so I politely declined. The second option was cortisone injections, every 3, 4, 5 months, whatever I needed, and I didn't want that either. I knew nothing about the body apart from what I'd studied through the martial arts. What I did know, or what I felt inside me, was the pain was like a flashing red light on the dashboard of the car, saying, hey, you have a problem. The pain was a sign that something wasn't right. So again, I politely declined the cortisone injection, and then something amazing happened. My pain was usually a solid 8 or a 9 out of 10 every single day. I couldn't sleep properly. If I rolled over onto this side, it would wake me up. When I decided to do nothing, my pain stabilized. It was still a 7 out of 10. It was very uncomfortable, but it didn't get any worse. It's as if my body went, okay, you're choosing not to go down that road, that's a good thing. And then something magical happened. My mother-in-law at the time was being treated for a fatigue condition called fibromyalgia, which again is a very difficult condition to diagnose medically because you don't have a blood test or a scan or an MRI and it says, oh, you have fibromyalgia, oh, you have post-traumatic stress. She had a series of symptoms which meant that on a bad day she couldn't get out of bed. So she'd been to see this guy, I'll use the term complementary therapist. Yeah? He was a world powerlifting champion, and he'd studied the body with a lot of ancient wisdom in conjunction with conventional wisdom to help him with his own injuries. So I went to see who I call Big Pete. He was a huge guy, about 30 stone of solid mass, and I'm lying on this inflatable airbed, fully clothed, and he's using this very, very light touch, feather-light on my system. And I'd seen the result with the mother-in-law. She went from being bedridden to literally within 9 months, she was running around the cliff paths like an 18-year-old. It was an incredible transaction. So I went to see this guy with an open mind, and it was probably about 20 minutes into the session, and he didn't ask me the question, he told me. He said, what did you do to your ribs? And I'd basically broken some ribs when I was fighting in Dublin in a martial arts tournament. They took 18 months to heal, as ribs normally do, so I had no more pain here. But what I had, which is the key to NVT, my body had unresolved trauma. I never had any physio done here, so the injury healed, there was no pain, but I couldn't breathe properly here. My diaphragm was compromised. So, as hopefully it'll make a bit more sense when I explain in more depth shortly, but there is something called fascia within the body. It's a very thin layer of connective tissue that permeates the whole body, a little bit like a spider's web. So all of this became compromised through my whole structure because of one injury. As a consequence, my spine was dragged over fractionally towards the trauma site, a little bit like a black hole, sucking the body in towards that point. And as a consequence, my spinal cord shortened a little bit. It pinched a nerve in my neck, which gave me the shoulder pain. Yeah? So every single person I had seen for the best part of 10 years had treated where the pain was. He was the first one that said, this is the problem. He treated me, and 3 weeks later, I'd say I was 90% pain-free after 10 years, one session. It was like a miracle, yeah? I had physical muscle growth back, I was able to sleep, I had 3 young kids at the time, I was running an engineering company, so there was a lot of stress involved. So to be able to get a good night's sleep was priceless. It completely changed my life. The other thing that I liked was every other approach I'd been to, the first question was, do you have health insurance? That was always the first question, followed by, let's book you in for 10 sessions. Yeah. There was a part of me that thought, what if I only need 3? What if I only need 5? There seemed to be a little bit about the money, which didn't resonate with me. It was the wrong reason for doing the work. So when I went to see Big Pete, he was the first person that didn't ask me any of those questions. When I finished the treatment and I said, do I need to come back? He said, only if you feel you need to. And that was very refreshing. So I did go back. I went back about 2 months later. I didn't need to. I felt absolutely amazing. I was pretty much pain-free by then. I was back in the dojo, back in the gym. I had my life back together again. But fundamentally, I was an engineer. I needed to know and understand, how did he use these when all the amazing conventional tools that modern medicine can have, like the scans, the x-rays, the blood tests, they didn't find anything wrong with me. He did, and I needed to understand that. So I learned 2 valuable lessons before I started the bodywork journey. Firstly was the limitations of conventional medicine. There is not one approach on the planet that has all the answers. Otherwise we'd all be using that approach. What I have learned is it's a combination of different skill sets working together bespokely, depending on what the individual presents, is what gives us ultimately the best resolution. The second one, I think, is diagnostically, from a medical perspective, I think we can be quite limited, and I say this is from an engineering point of view, we're quite limited diagnostically with the tools available. With the possible exception of the physios, nobody uses their hands anymore. So again, my case being a prime example, nothing showed with the scans, the x-rays, or the blood tests. So with conventional medicine, what you need is you need to find something wrong in order to formulate an evidence-based treatment program. If you can't find anything wrong, it can become pretty much guesswork based on the skills of the clinician and their individual interpretation of the symptoms on that given day. And this is why I think a lot of people get caught in a spiral of ongoing treatment that can carry on for many, many years, especially if we're dealing with emotions. I believe, I'm going to go right back to basics. To understand NVT a little bit more, we need to understand my engineering mindset on how the body functions. And to do that, we have to go right the way back to the beginning. So at conception, when sperm fertilizes egg, 2 magical things happen. Firstly, a shaft of light is created, which is visible under microscope. Yeah? That shaft of light goes on to develop into what we call the central nervous system. It comprises the brain and the spinal cord and the housing that it sits in, which will make more sense when I go into a bit more depth shortly. So the shaft of light is created, and over the next 40 weeks or so, the body grows and develops from the midline outwards. Yeah, that's very, very important. The midline becomes very, very important. If we lose balance within the midline, we effectively lose the capacity to self-heal, which is what NVT is all about. Yeah. The second thing that occurs at conception is a blueprint is created. A DNA blueprint, a set of plans, is there to enable us to grow, develop, and very importantly, to self-heal. Yeah? So from an engineering point of view, I always looked at the body and thought, why would we try to fix a self-healing mechanism? There's no logic to that. What we might be able to do, if we had the skills, is to develop certain protocols and techniques that would enable us to identify why the self-healing mechanism was compromised. If we could do that and find a way to remove that from the system, we would achieve the restoration of the capacity for the body to fix and repair and heal itself. Yeah? I don't want to be seeing somebody once a month for the same problem. Yeah? That's not what NVT is about. So basically, my own personal journey was I went back to Big Pete and I started to learn some of the techniques and the protocols that he adopted. And after a few years, my engineering mind was taking me down a different pathway. I was finding very quick ways to get a resolution to people's imbalances by adopting an engineering approach. So There is a science behind MVT, which I'm going to share with you now, and it's very important that if I'm stood in a room full of medical professionals, neurologists, I need to be able to explain in their language what it is that I'm doing. They will have no concept of how we can achieve this with just our hands, but there is a distinct science to it. So, at conception, shaft of light is created, the body grows and develops from the midline outwards, but very importantly, the DNA blueprint for self-healing is created. Yeah? So in an ideal world, when we make our arrival, what happens, our skull plates implode, they fold in on one another to facilitate the easiest delivery for mother and child. Yeah? When the cord is cut, something magical happens. It kickstarts a production of fluid around the brain and the spinal cord. So if you visualize, I'm not going to go into any anatomical depth, there's no need for that, but I'd like you to visualize a balloon in the shape of a tadpole that has a head and it has a body. Yeah? So effectively, in mechanical terms, we have the brain and the spinal cord floating in a sea of fluid within a tadpole-shaped balloon. So our skull plates are molded very strongly to the outside of the head, and there's a very strong connection to our tailbone or sacrum to the very bottom of the balloon. So this is why I love it so much. It's a purely mechanical system. When the cord is cut, it kickstarts a production of fluid called cerebrospinal fluid. It's a byproduct of blood that's created and filtered within the brain. So as this fluid is produced after birth for the first time, the concept is the balloon expands and it pushes the plates apart after the delivery. They will float individually and begin to knit together at about 4 or 5 months of age. That's where the problems begin, especially if there's need for a medical intervention during the birth process, maybe ventouse, forceps, if baby has cord around the neck, if there is some trauma other than natural birth forces. The pressure that is created by this fluid production is not sufficient to push the plates apart if we've had a surgical intervention. Yeah? I personally believe, after 20,000 plus treatments, that at least 60% of all the baggage we carry through life as adults could be prevented if we could find a way to treat every newborn. I think it's that important. Yeah. Let's have a look at how that impacts on the system, and it'll make a little bit more sense. Cord is cut, kickstarts this production of fluid, and the plates move apart. Now, all of the skull plates fit together as they begin to develop over sort of 4 or 5 months of age onwards. They fit together like a tight-fitting jigsaw, but there are spaces, there are joints called sutures, and we have pressure receptors in there. So from a mechanical perspective, what happens is the fluid is produced, the skull plates move apart very slightly, and the pressure receptors send a signal back to the brain to say, hey guys, we've got enough fluid now. So the fluid production slows down. Some of that is reabsorbed back into the blood supply from whence it came, and what happens is the balloon begins to contract. So there is roughly 3 to 5 seconds of contraction of this balloon or membrane, followed by 3 to 5 seconds of reabsorption. And the key, and this is one of our most valuable diagnostic tools as an MVT practitioner, is the movement of these membranes, and the expansion and contraction of the bones creates a physical movement. So in an ideal world, the base of the skull, or the occiput, if it sits correctly on the top of the neck, as this balloon is expanding, it functions just like a swing. It will rock down towards the feet as the fluid is produced, and then it will gently rock back up towards the head during the reabsorption phase. So for 3 to 5 seconds, it gently rocks one way, and then for 3 to 5 seconds, it gently rocks the other. Now the body of the tadpole is anchored very strongly to this bone, so the mechanical movement that is created, as this bone rocks backwards and forwards, the tube begins to drag up and down through the neck and the back. Again, this is anchored very strongly to our tailbone. So in a healthy, functional central nervous system, the base of the skull and the tailbone function just like 2 ends of a swing bone. They rock backwards and forwards together for 3 to 5 seconds, followed by 3 to 5 seconds the other way. So what this does mechanically to the central nervous system, where we have all of our nerve endings that pop out between the vertebrae and the back, I always visualize it a little bit like seaweed under the ocean, just gently flowing backwards and forwards. As this tube is mechanically dragged, this is a tiny movement, but it is perceptible. As this tube is dragged up and down through the neck and the back, these nerve endings are just very, very lightly moving backwards and forwards. So it's the mechanical way to keep all the nerve endings free of restriction and lubricated. And what that gives us is what we call a parasympathetic state, so that our nervous system is fundamentally in a natural self-healing state. Yeah? Let me go back to baby. Let's assume that baby has a little bit of trauma during the arrival. Maybe there's a medical intervention, maybe there's a cord around the neck. So baby is born in a fight or flight state. Yeah? So the nervous system, for me, keeping it really simple, has three fundamental basic states. Level one is a natural self-healing state. Number two is if we perceive some kind of a threat, then our system automatically reverts from that natural repair mode into a self-preservation state while we assess and deal with the threat. Now, of course, there's two kinds of threat. There's internal pressure that could be applied to the nervous system from unresolved trauma, or the environment around us that we find ourselves in. Yeah? So in an ideal world, we would assess the threat, and when we feel back in a safe place, we would revert from that level two back to a natural self-healing state. Yeah? The problem comes if we have an event or combination of events that are unresolved within the body. Unresolved trauma results in a constant state of number two. We get locked in a number two. And there is a process which I'll explain in more depth in a moment. I call it a circle of dysfunction. Every single person in this room, myself included, is a walking, talking library book of what we have been through in life, lived experiences. The key word is unresolved trauma. Yeah? If we have an event that we experience, and 3.5 to 4 months after the event, the body's not been able to revert back to the pre-traumatized state, what it does, it actually alters your DNA. The original plan that's there, the original blueprint that we use to grow, develop, and self-heal becomes compromised because the body says, hey, I've had this opportunity to self-heal, to revert back to the pre-traumatized state. If I couldn't achieve that, I now have to learn to live with the problem. Yeah? Because fundamentally it's all about survival. So what the body does, it makes changes to the musculoskeletal structure, it makes changes to the endocrine system in order now to work around the problem. This becomes part of us. So the new DNA blueprint includes the imbalances. Yeah? So how can we diagnose or assess that these imbalances actually exist within the body? So we have this mechanical movement that we can use. Remember the midline, the significance of the midline. We have this balloon that is expanding and contracting on our center line, creating a physical movement within the skull plates. That's the first diagnostic tool that enables us to work with conditions that will not show on scans, x-rays, or blood tests, because it's mechanical. You have to feel it. Yeah? The second most valuable diagnostic tool that we have, which I touched on earlier, is something called fascia. So fascia, I want you to visualize that in simplistic terms as a spider's web that permeates the entire body. So if I tap the top of my head, I send a ripple through the entire system. Yeah? So everything is connected to everything else via fascia. So we have the midline that's expanding and contracting. So because of the connectivity of fascia, my entire body expands for 3, 4, 5 seconds as the fluid is produced and the membranes are expanding. And then during the reabsorption phase, my fascia is inwardly rotating back towards the midline. Yeah? So if I hold someone's feet very lightly, I'm looking for a symmetrical sense of expansion and contraction. If I go to the knees, the hips, the ribs, the shoulders, I'm looking for this sense of symmetry. If I get to the pelvis, for example, and what I feel is, one side is definitely not functioning like the other one, but the knee feels okay, and maybe the ribs feel okay. I know that diagnostically something between here and here is having an impact on the mobility of the pelvis. And if the pelvis is compromised, guess what? It's going to affect the mechanics of the system. So the whole pack of cards begins to tumble down. So the circle of dysfunction, basically, a lot of our imbalances begin here in the neck. Yeah? Let's look at cats, dogs, most other mammals. They're on 4 points of contact. It's beautiful from an engineering perspective because their back is like a suspension bridge on 4 points of contact. Yeah, there's no load physically on the back, and they have this beautiful head and tail that counterbalances. So animals don't tend to, barring physical injuries, they don't tend to get the imbalances we do. At some point, our ancestors thought it was clever to walk upright, and it does give us certain advantages. But our body is still an evolutionary work in progress. Our muscles are not strong enough yet to support the body permanently, which is why a lot of us walk around like this. Yeah? So a lot of our problems begin here. We get compression at the base of the skull, which other mammals don't get, and this causes a big problem. What we have, the top end of our swing boat, the base of the skull, it interacts with two bones behind the ears called temporal bones. Where these bones knit together, we have one on the left and one on the right. There's a little tunnel or an opening called a foramina. And what passes through there are 3 of what we call cranial nerves. We have 12 in the body. These are cranial nerves 9, 10, and 11. And we have the blood supply directly from the brain back to the heart. So an event or combination of events, unresolved fascia and compensatory patterns through the system, that cannot happen. The balloon is being constantly squeezed. There is an external force applied to the nervous system. When this occurs, the nervous system senses that as a direct threat, and we move from that level 1, that natural self-healing state, into a state of self-preservation to assess and deal with the trauma. The pack of cards at that point begins to tumble. So these nerves will very often at this point become compromised in the base of the neck. Cranial nerve 9, we're not too worried about. Cranial nerve 10, anybody heard about vagus nerve?
Yeah.
It's a big buzzword in the field of trauma at the moment. A lot of conventional medicine and wisdom is beginning to acknowledge how important this is. Well, this is cranial nerve 10 and cranial nerve 11. Oh, do we have any body workers in the room? No. Well, cranial nerve 11 is, we have 3 nerves that run parallel. Cranial nerve 11 often gets forgotten about by every practitioner I know. And yet it's one of the most important in the body. All it does, it controls 2 muscles. The little one from the bottom of your ear down to the top of the collarbone, and the big trapezius muscle that connects to the base of the skull. It comes out to the shoulder and then down to your mid-back. So if one of these nerves is compromised, all 3 will be. So most of the people I treat with NVT, these are people like myself that have long-standing undiagnosable conditions. They've been everywhere, tried everything, and either they're not responding to conventional approaches or they've reached a plateau and they can't move forwards any further. Yeah? We get results by not doing anything clever. We use the body. Ultimately, I'll see 100 people for back pain, but how they acquired it is unique to that person. So with NVT, what we do is we use the body's inner intelligence, its ability to tell you exactly where the problem is through compromised movement in the fascia and the mechanics of the central nervous system. Yeah? So we can very accurately pinpoint where unresolved physical trauma exists in the body. Because this circle of dysfunction is very, very important. An event or combination of events dislodges the head on the top of the neck. So all of a sudden it's important to understand we not only have a neurological imbalance, but we have a musculoskeletal one. Yeah? With most people who have long-standing unresolved trauma, what will happen is you'll notice they have an elevated shoulder on one side. These are the people that will be seeing the physios, the chiropractors, the osteopaths. Feels great for a week or so, but then slowly but surely it comes back again. Because ultimately, if we keep it in simplistic terms, on a structural perspective, your body is nothing more complex than a bag of bones held together with elastic bands. Yeah? But if the nerve signal from the central nervous system is to tighten those muscles, then ultimately we can massage and stretch them, but nothing's really changed. The signal is still to contract. So what happens after a week or so, it starts to come back. But again, we are that bag of bones held together with elastic bands. So if I have an elevation here, it's going to elevate my rib cage. It's also going to elevate my hip and inwardly rotate it. So the entire structure becomes compromised because of one little imbalance at the base of the neck. Yeah? So it's important to understand that most people will present an imbalance in the neurology and also the entire structural balance and integrity of the body. So a lot of people who come in, for example, for emotional trauma, anxiety, depression, all kinds of imbalances, they will also have physical pain because there is no separation for me between emotional and physical balance. You cannot have one without the other. The 2 need to work hand in hand. Yeah? So with this circle of dysfunction, it's again, we have physical and musculoskeletal imbalance. When we do a simple diagnostic test, which I'm going to share with you shortly, because one of the important messages for me to get across with whoever I'm working with, whichever profession somebody is in, there is a very quick diagnostic test. I got frustrated in my own journey. If somebody had signposted me at the very beginning with my shoulder issue and been able to do this test and say, oh, you've got a problem with the nervous system, you need to go and see so-and-so, I would not have got stuck on a hamster wheel of seeing everybody that I thought could possibly help me. I would have gone over straight to the person that could have helped me, and then what other interventions I needed would have been far more successful rehabilitation phase. So when these nerves become compressed, what this diagnostic test will show you is that we have something called ventral vagus dysfunction. And the ventral vagus nerve is a branch of our fight or flight mechanism. It does three very important things in the body. It controls a balance signal to the heart, it controls balance signal to the lungs, and here's the mechanical aspect that when I discovered this, it completely changed my approach to treating unresolved physical trauma, because I didn't understand the full function of the nerves. But if this nerve is dysfunctional, it controls the top third of the pipe that carries the food and liquid to your stomach, called the esophagus. So if this pipe shortens, then what's on the other end? The stomach will get physically elevated under the left rib cage. So a lot of people will have reflux, indigestion, heartburn, digestive imbalances, and many people will have what's called a hiatus hernia, when this elevation has been there for so long that part of the stomach gets pulled up into the cavity above where the heart and the lungs are. Yeah? Now the clinical significance of this is we mentioned, we touched on our vagus nerves. We have two, one on the left and one on the right. Now when we study the anatomy, these two nerves follow the esophagus down through into what's called the hiatus. It's a posh word for a hole that separates this cavity from here to here. So as these three, we have our left vagus nerve at the top if somebody's lying down, then we have our esophagus and we have our right vagus nerve underneath. So what that does in mechanical terms is this pipe shortens, so the stomach gets sucked up here, and there will always, almost without exception, be a compression of one or both of the vagus nerves. So I don't know if anyone's ever seen on TV World's Strongest Man. You've got these huge big guys pulling trucks. Yeah. If I use that analogy, if they get hold of the rope where it connects to the truck, you can pull and pull, and that truck goes nowhere. But if you go to the other end of the rope and you slowly lean in, the truck starts to move. So using that same analogy, the rope, in our case, is the left or right vagus nerve, and the truck is the brain stem. So if I have an imbalance down here, and there is effectively a pull on my brain stem from the hiatus, the nervous system senses that as a direct threat. Now remember, we already have compromised neck and shoulder muscles. At this point, we'll have erratic signals to the heart, we will have erratic signals to the lungs, so somebody might be experiencing symptoms of anxiety because there's a problem with the balance between respiration and cardiac function. So when you can't breathe properly and your heart is a little bit erratic, you will have symptoms of anxiety, which if it's there for a long time, will become depression. Yeah? Because the entire endocrine system is also compromised. But when the brain senses this distal mechanical pull, the only option it has is to further tighten the already compromised neck and shoulder muscles. And that completes what I consider the circle of dysfunction. So these are the people that we could take, maybe a lot of the military veterans and serving soldiers that I work with. We can take these people, put them on a beautiful beach in the Philippines without a care in the world, but they will still be on full alert. They will still be looking for the lion in the room because their nervous system is wired that way. Yeah? So what this diagnostic test confirms, if someone is a psychologist, psychiatrist, medical doctor, I encourage as many people as we can to do this test, because if we had a flow chart of intervention and a new client or patient comes in, irrespective of someone's professional background, do this test and it will confirm within 30 seconds, without even touching someone, that the central nervous system is compromised, so that person has lost the ability to self-heal. Very important to understand. It also confirms they will have a structural imbalance as well as a neurological one. Yeah? And that they can be signposted for direct mechanical intervention, but very light mechanical intervention. There's no manipulation here. This is all very, very gentle. I think if we could do that and get this message out there, it would prevent so many people from being stuck on this hamster wheel of, let's see if this works, let's see if this works. The average amount of treatments I give people, so Sorry, did that make sense?
Yes.
Okay. A little bit of a jet lag.
Only one question. What are the three nerves you were saying below the biggest nerves? What's the name of the three nerves?
These three, cranial nerves 9, 10, and 11.
Is there a name to it? 10 is vagus, right?
10 is vagus. Glossopharyngeal nerve we're not too worried about. That's all to do with swallowing and tongue movement. And cranial nerve 11 is the nerve that controls our two main neck and shoulder muscles. Yeah. So basically with NVT, what we're able to do is to ascertain, A, that the nervous system is compromised, B, that there is a mechanical component to it, and then C, by using this assessment, this hands-on assessment of where the fascia is compromised, what we can do is we can help to alleviate compromised trauma from the body. And we do that using something called the key and lock principle. If I have somebody that comes into me with unresolved trauma, I have to be very, very aware that the compensatory patterns they adopt, maybe their neck is over to one side, for example, there is no way that I want to manipulate that head back to what I think it should be. Because maybe the compensatory patterns that person has adopted is actually keeping them alive. It's part of maintaining this homeostasis. So everything we do with NVT, A, the body is in charge, very, very important. And secondly, because there is no manipulation, everything that we do is an invitation to change. And how do we do that? We do it through something that I've developed over the years called the key and lock principle. So let's just say my own ribs as an example. Then maybe I would say I'm going to work with this respiratory diaphragm, so I might place a hand across the top of the shoulder and my other hand here. Very, very light. Imagine, people often get off the couch and say, you didn't do anything. I didn't feel anything. That's how it should be. Every imbalance that we have in the body will always manifest on the surface of the fascia. Imagine if you were in a helicopter and you were flying over the ocean and there was a volcanic eruption that was occurring deep down. Then the ripple effect would break through on the surface of the ocean somewhere. So if you were in a helicopter, you'd be able to see exactly where the trauma site was and you could follow it down to the right depth. This is exactly what we do with the NVT protocols. Every imbalance will always manifest on the surface of the fascia somewhere. So using the key and lock principle, what we have is a working hand and a listening hand. One hand is basically listening for the depth that the body wants to be held at so that it can release its own restrictions. That's very, very important. Yeah. So we have a working hand and a listening hand. The key and lock principle is if I have a lock and a key, the first part of the process is I have to put the key into the lock, but I have to put it into the right depth. Otherwise, it's not going to function, even if it's the right key. So with the key and lock principle, imagine you had a little bit of cling film or a towel on the worktop. You were holding one end, and I held the other. If I very gently and slowly started to pull my end, initially you feel nothing, because I'm taking up the slack. When there's no more slack, you would feel the connection. Yeah? So that's the first part of the concept, is that the listening hand, the working hand goes into the depth that connects with the listening hand. It's very, very subtle, but you can feel it. Yeah? Once the key's into the lock, even then, if I don't turn it in the right direction, or I turn it in the right direction but not far enough, it still won't clear the restriction. So this is when it gets a little bit crazy with the engineering mind, and I developed, using quantum physics, this concept of intent changes reality. I don't know what the body needs. I really don't. I might have an idea after so many treatments, but it's unique to the individual. So by using intent and quantum physics, what I do is the working hand has dropped into the depth. That gives me the connection with the listening hand. But then what I do is I visualize it. It gets a little bit crazy, but you need to experience it to understand it. Quantum physics is intent changes reality. I visualize a circle, a 12-hour clock, and two things will happen. As I slowly send my mind around the circle over the working hand, there will be a point on that circle. It could be 3 o'clock, 6 o'clock, 4:45. There will be an angle where your mind gets stuck. And this sounds crazy, but what it'll do if you start to question your sanity is that it will coincide with a tightening of the fascia. Because when you are able to assess a part of the body that's compromised, what will happen is the body's inner self-protection mechanism, because as mammals we're not designed to show weakness, because other mammals will take advantage of that. So if we can highlight an area that's compromised, what will happen is the system will contract as if to protect. Yeah? And this is what we feel, the fascia tightens. And then something magical happens. It's called a therapeutic pulse. It's a change in the cellular activity of the protective muscle pattern around a compromised nerve or nerves. It's like a little heartbeat that suddenly appears in the tissues from nowhere. And it's the body starting to release itself because it's being held at the angle and the depth that it wants to be held at. The only reason that trauma still exists is because the body was unable to self-heal, because it needed that little external force to be applied to enable it to unravel its own knots. Yeah? So something called a therapeutic pulse appears, and then everything goes very still, and the pressure will very often build up between the 2 points of contact. Then, usually within 30 to 60 seconds, there is a sense of softening, widening, and expanding away from the midline, as if somebody's taken their finger out the spider's web and the fascia returns to the pre-traumatized state. So the more we can achieve that within the body, the more pressure comes off the central nervous system. The pressure is physically released off the balloon, and there is a magical point which we try and achieve during every session, our first session, when the autonomic system reboots. So the autonomic system is the part of the nervous system that controls things you don't think about. You don't think about your immune system, you don't think about digestion, it all just happens. So when the central nervous system no longer feels threatened, it's like somebody flicks a switch and the autonomic system resets, and the body's natural state and capacity to self-heal has been restored. Fundamentally, it's that simple. Everything's gone quiet. There is a distinct science behind NVT, and it's important to understand it, but fundamentally, I get the best results. I'm not an academic. I left school at a very early age because I struggled with the concepts of big, tall things that didn't really resonate with me. I'm much more hands-on. So I developed these techniques and protocols over the last 20 years by understanding how something functions, how it should feel when it functions correctly, and then being able to determine that it's not working the way it should. So we need the clinical understanding, we need the knowledge of the anatomy behind us, but one of the most important aspects of the work is intent. And this is something that, again, is starting to become explored. Joe Dispenza's doing a lot of work there, lots of other powerful people using meditation. What happens when you meditate? What happens if we pray for someone who might be ill? That intent, that thought process changes reality. There is a connection, without going too spiritual about it, there is a connection. We have one below. All the plants in the planet connect with each other via an interconnected root system. And there's another system above that we can plug into. And this is what excites me the most. As I'm connecting with neuroscientists, we're beginning to explain, or they're beginning to explain to me what's actually happening in the system. I know the system is being restored back to a self-healing state, but they're able to tell me what happens with the various parts of the brain, because we can physically see it on the MRI scans. So as I begin to get more of a clinical support for the work I do, it's starting to fill in the blanks. I know I'm making a difference, but to understand that at another level, there's a part of the brain called the amygdala, and this is a very important aspect of the work I'm developing with other practitioners, because we spoke about this DNA blueprint that's there at birth. Well, every single one of us is a result of mum and dad's blueprint. And of course that ancestrally gets passed down from generation to generation. So if all of us carry unresolved trauma, then with each generation we're moving further and further away from that original blueprint. So by working with the amygdala, there's two parts to the amygdala. We have a left and a right, and one holds trauma from this lifetime, and one holds ancestral trauma. So we found a very simple way to tap into the amygdala, get a response through the nervous system and the fascia, and actually find a way to clear that ancestral trauma so it no longer gets passed down the line. This is something that's very important that I'm working with other therapists at the moment to develop, because anyone can bring this into their practice, and I think that's something that we can give to the next generation moving forwards. So that was a lot to take on board. Yeah. Any questions at all?
You dealt primarily on the physical. you also mentioned there's the mental and emotional. So how does this cover those areas?
Okay, so the emotional aspect, when we're in a natural self-healing state, our endocrine system, which is basically the body's chemical processing factory, produces chemicals to keep us in a happy state. Yeah? When we're in a fight or flight state, when we're in that self-protective mechanism, everything changes. That self-healing state becomes compromised as we drop into this level 2, this self-preservation state. Now, in an ideal world, this self-protection state is meant to be for short but intense periods. So for example, we're running away to survive, or we're trying to catch something to survive. Within a few hours, we're back in a safe place, and our body will naturally revert from that 2 back to the 1. Now, if we have unresolved physical trauma in the body, and most of us have this residing within us, then when the body mechanically becomes compromised to the point that we get locked in this level 2, we lose the ability, even in a safe place, to revert back to the self-healing state, then the chemical balance in the body begins to break down. Yeah? So there is a level 3. Level 3 we would see with the more chronic conditions, maybe the veterans with chronic post-traumatic stress, people who have been suffering with undiagnosable medical conditions for many years. The system begins to break down. We'll start to get maybe imbalances with kidney, bladder, urinary infections, because the adrenal glands are constantly on alert, and they're not meant to be. So the system, it's like you're in the middle of the Atlantic and just treading water. It's a struggle to keep your head above water. So if someone has been trapped in that, if they've lost the ability to self-heal and their endocrine system is compromised, level 3 is the higher end of the spectrum. I usually find this goes one of 2 ways. Either somebody becomes a boiling kettle, they're angry all the time, you look at them the wrong way, you say the wrong thing, they're going to explode because they need a release. It's not pleasant for them or their loved ones, it's how they're coping with the symptoms. The other way, which I see with many of the veterans, because what happens in this fight or flight state, you become hypersensitive because you're on full alert. So noise, light, taste, touch, everything around you becomes hypersensitive. So walking in the shopping mall on a Saturday afternoon where it's full of people is just too much. It's just too much of a stimulus to an already compromised system. So level 3 is either boiling kettle, or we go the opposite way. We put ourselves in a little bubble and we disconnect from everything because it's too much, it's overloading our system. So we survive by not being seen, not being heard, not interacting. And again, that's really tough for them and for their loved ones and their family, because it's difficult for people to understand, especially if they're seeing some of the counselling or talking therapies and they're being told there's nothing wrong. Yeah.
So basically what you're saying is the mental and emotional states are dictated by the physical, and they're not independent.
It's yin and yang, the 2 function together. So somebody might experience an extreme emotional trauma, and if they're unable to self-heal within 3 to 4 months, that then has a physical impact on the system. If somebody has a physical compromise and it's not resolved within 3.5 to 4 months, because of the imbalance with the endocrine system, that will start to impact on the emotional balance. The 2 for me cannot be separated. You cannot have physical imbalance without emotional, or emotional without physical. So with NVT, I would say 95% of the people that come in with an emotional imbalance, maybe depression, anxiety, high alert, ADHD, once we've addressed the physical, 95% of the emotional disperses within 3 to 4 months. I'm going to touch on this very briefly. Because NVT is not about fixing, healing, or repairing anyone, there is a natural repair cycle that takes place in the body. So if I break a bone, that bone will take roughly 3.5 to 4 months to restore itself to full integrity. You can't change that, it's a natural repair cycle. So we spoke about how the DNA becomes compromised after 3.5 to 4 months. Then what happens if we're able to do our work and the body's system reverts back to a natural self-healing state? There are 3 phases to the treatment. After an initial session, for 3 to 5 days, people will often report they've been hit by a truck, because their system goes from this, because this feels normal to someone, yeah, bearing in mind we may be carrying some unresolved birth trauma, so maybe they've been like this a lifetime, this feels normal. So when their system finally goes, that's a big shift. The endocrine system, the chemical processing factory, everything changes back to a new baseline that they may never have experienced. It's a big deal, yeah? That will take phase 2, which is about 3 to 4 weeks to integrate, for the body to begin to function in a new manner. Yeah? And then for me, the miracle is 3 to 4 months. If after 4 months, the issue has not returned, generally if the work I do, if the fascial web is restored to balance enough that it doesn't compromise within 7 to 10 days, then the benefits are permanent. But the miracle is that 3.5 to 4 month cycle. After 3.5 to 4 months, the body will revert back to the original pre-traumatized plan that was there at conception. So even if somebody's had an imbalance for many, many years, 3.5 to 4 months, the body will have reverted as much as it can back to the pre-traumatized state. So many people will say, oh yes, but it's always going to go back because it always has done. No. After 3.5 to 4 months, the body effectively forgets there was ever a problem in the first place, if that makes sense. So this is why the emotional and the physical are very, very closely linked.
Can I ask you a question? With the people that you have worked with, is it more of the emotional aspect that has caused the physical capacity or pain, or is it the physical that has caused the emotional? Which
in my own experience, I'm a great believer that the universe has this strange way of guiding people to the right ones for help. So I know there are some specialists in the emotional world, and they do some incredible work. So I'm the nuts and bolts guy. I'm the hands-on, I'm the body mechanic. So I would say 95% of the emotional imbalances I deal with come from a physical original imbalance. So once I've addressed that, only 5% do I need to use some different tools which are specific for emotion. And then even then we connect in with the system, with the intelligence of the nervous system and the fascia, and we can actually find out at what age that occurred. Was it this lifetime? Is it ancestral? We can very, very accurately and specifically be told by the body where that trauma existed, at what time it occurred, and invite an opportunity for that to disperse through the system.
You're also saying that it may take from 1 to 4 months for a situation to go back to its original state as intended by nature.
Correct. 3.5 to 4 months. We can't speed that. So I might only see somebody once.
Or 3.5 to 4 months.
3.5 to 4 months. I might only treat somebody once, but the process of getting the full benefit will be 3.5 to 4
Okay,
months.
but you can start already from the beginning. You start feeling it.
Absolutely. And once I've seen somebody, I might give them some self-help techniques, maybe a little exercise to keep the vagus nerve free, maybe a couple of simple stretches to restore the symmetry to the fascia. Once I've treated someone, I will give them some very simple, a few minutes a day, to keep them moving forward to maximize the benefit.
So, say you treated somebody here, and then you go back to Spain, okay, we still communicate with you on the phone?
100%. Yeah, that's part of the backup. It's
That's
for
part
me
of
to get somebody through as far as I can
Okay.
towards
So
that process.
your physical presence doesn't have to be here. You can continue to help that person
Correct.
while you're
With intent in quantum physics. Sorry.
Sorry, I'm interrupting. You can finish. Go ahead.
Yeah, well, there is the capacity to work remotely, so we can tune into a system energetically from a distance. I can work with people in the other side of the world as long as I can either get a name or a face or physically see them on the camera. I can get a sense of what's going on because it's intent, and I've been playing with this for many, many years, and I think the only limitation is your own belief system. If I believe I can work with a dog in Mongolia, the only thing that prevents me is my belief system, because once I've pictured it and visualized it, I can tap into it and I can work with it as if I was physically there. If it's a really deep physical restriction, sometimes it's nice to have somebody on the other end who might be able to hold the body in a certain position, but a lot of it can be done remotely. So yes, I can continue to support people from a distance.
We have mentioned you have manifested the problems of the physiognomy, anatomy of the body, physical, psychological. Now we come to the remedy of the cure. In what direction do you go as far as the remedy and the cure is concerned? Is it manipulation, or is it herbal, or is it psychological, or physiological? How do you give us the remedy or the cure for whatever is going on, the disabilities that are going on in our body?
Well, the remedy is through the fascia and the mechanics of the nervous system. So this very light touch in parts of the body that we identify as compromised. And then as that releases, it takes pressure off the central nervous system until the degree that so much pressure has been released from the system that it automatically resets. A lot of people, especially within the medical world, for example, if someone has a thyroid problem or a problem with the endocrine system, that we try to address that autonomic state directly. All I've found is that there is another stage further, which is the central nervous system. If the central nervous system is compromised, the autonomic nervous system will always be. So by taking the pressure off of the central nervous system, the autonomic resets naturally and the body starts to self-heal. So it's very important to stress, my job is not to fix or self-heal, to heal or repair anyone. It's a natural process. If we can restore the natural capacity to self-heal, that's where the magic happens. But of course, we're not very patient as human beings. We want the magic pill. I've had this problem for 40 years, but I want it to be fixed tomorrow. It's not going to happen. If we understand the 3.5 to 4 month DNA cycle, an imbalance that may have taken 60 years to get to the point of where it is not going to disappear in a matter of days or weeks. We have to go through that 3.5 to 4 month cycle. So in my own experience, usually within the first 3 to 4 weeks, there is significant marked noticed improvement because the body's already moving back towards the pre-traumatized state. But the full benefit is 3.5 to 4 months.
So we presume that you will be in the Philippines for another few months or weeks, because on the assumption that one of us starts a treatment and halfway through you have to go back to Spain or whatever, or wherever, then are we left in limbo or what happens?
So I think there's a good probability that I will be coming back based on the feedback that we've had so far, but it does touch on a very important part because none of us are getting any younger, myself included. So the long-term legacy that I want to leave is if people experience the work and they really resonate with it, then what I want to do is, this is why I've taken time out from being in the therapy centre, if I can help 5 people a day, then fantastic. But the long-term legacy is to actually get people trained up. And then from that group of students, there might be 1 or 2 people that really resonate with the work, and then I can focus on them to become teachers.
How would you compare your treatment to manipulation of the nerves? What's the treatment called? Physiotherapy?
Or chiro,
yes. You hit the right word, chiropractic.
Well,
How would you compare
is
that?
The opposite end of the spectrum from manipulation. Everything has its place. Back in Spain and Jersey, obviously I've been there for many, many years, so I work very closely with a lot of the chiropractors, the osteopaths, the physios. If the work they're doing is helping someone to get to where they need to be, fantastic. What we tend to specialize in is the people that maybe those approaches reach a plateau, maybe they get to a point of rehabilitation where that person can't go any further, they get stuck. Generally, that means that the nervous system is compromised. We will use our interventions, and then the other approaches will be much more effective. With the counselling and the talking therapists that we work with, what they find is it's very, very difficult to talk a problem out of a system that is a lot like this. So if we do our intervention first and the system goes far, then a lot of the emotions. I'll go back to your question a little bit if I can, because it's all overlapping circles here, but if we have an unresolved physical trauma and the fascia is compromised, it's like clenching a fist. So let's imagine I was involved in a car accident. I wasn't ready for it, somebody hit me from behind, and as my system tightened, there will be a mix of emotions, as well as the physical, anger, frustration, maybe a bit of fear. So I can try and treat those emotions, but through this, it's very, very difficult. If I can get this to go, then our body is naturally designed to not hang on to things. We learn from the experiences. Tell me a mum that would have a second child if she remembered the trauma at first. Not many, yeah?
So I cannot answer that.
Now,
So you'll be working on the psyche of the patient, psychologically, to talk to the patient, and maybe psychologically you could probably be curing him also.
Sometimes I will verbalize, but I would say 95% of my work is non-verbal. Because I'm connecting with the inner intelligence of the system that ultimately knows where the imbalance is. If you had trauma from birth, you're probably not aware it even existed. But your system would be holding that pattern. So a lot of it is connecting with the inner intelligence of the system.
Can you give us, I'm sorry, please, first.
Wait, Ramesh, sorry, there's a few questions back here. Sorry.
Hi, to follow up on the modalities that you're using, because I've never heard of your new vision therapy. Is that something like the sacral perennial therapy
Yeah,
of a pleasure?
Yeah, I qualified in upledger craniosacral myself, and what I found, it was very, very powerful, and it creates a really solid foundation for working with the mechanics of the central nervous system. And I give thanks every day to Dr. John, because he allowed me, as a mechanical engineer with no background in a medical profession, to be able to study that work. So I give thanks for that every day. Through my own trying to give back and creating a network of therapists, I make sure that this knowledge is open to non-body workers as well. Very, very important. So yes, there is a lot of overlaps with the craniosacral, but what I found over the years, again, I touched on it earlier, I don't believe any one approach has all the answers, myself included. What I have done is I've studied as much as I can from different people, different knowledge bases, different sources, and I've taken a bit of this and a bit of that. And new vision therapy is basically my concept of how I can work with the body and how I can train other people to work with the body. Let's assume in your house you have a fuse board, and that fuse board, where the cable comes out the road, controls and coordinates every function in the house. So if a circuit breaker trips and the lights go out, well, we don't rewire the house. We do the simple things first. We check maybe the lights, we check the fuses. NVT is basically going back to the central nervous system, to the first thing that could go wrong, because everything after that becomes effectively a symptom. So I get results by keeping it simple, understanding the anatomy, but it doesn't have to be an in-depth understanding of the anatomy, just a basic clinical understanding of how it functions, and maybe being able to visualize what you're working with. And by sending your intent into the system, it has an impact on the fascia and the mechanics. So NVT is one of those things that probably needs to be experienced for it to make more sense. Would you like to try something? Try and feel it?
Yes, sure. I have a very simple question. You mentioned earlier that you are a body mechanic. So if you look at any individual, would you be able to determine that is something wrong with the person, or if the person is perfect?
Just by
Nothing is
looking.
wrong, just by looking at the person, would
Yeah,
you?
I try not to, or I'll never get from one end to the
Because I've done a lot of cranial sacral and fascia as well. I'm living in New York. There are a lot of people doing that. And I just wanted to know, do you continue doing that? Because, you know, after New York, I moved to Bombay, and they had the cranial sacral, but it wasn't the same as what I experienced in New York. That moment was the Indian moment, which was exceptional. And the myofascia I did there too was really the thing he had learned in Australia. And what I'm doing here is a different thing. It's not the same. Are there different ways of doing it, or, you know, I mean, everybody has.
Yeah, it's.
Because I found the fascia that they do here, they're really stretching too hard, and what they did in New York was a different sort of. He could immediately pinpoint the part that I needed that.
Well, with the key and lock principle, the important thing to get across is that the body's in charge of the entire process. So the angle and the depth that the body wants to be held at will be unique to the individual, because the body's feeling back that communication. So really, as an NVT therapist, I'm only interested in one thing. I'm interested in anything in the body that's having a negative impact on the balance function of the nervous system. If I make contact with a part of the body and it doesn't impact on the nervous system, even if somebody's experiencing pain there, then it means there's something else that's more relevant and more important. Yeah? Everything is connected. We have this, I don't know if anyone is familiar with Thomas Myers anatomy trains. This is basically, if we conducted a dissection on somebody, there are certain muscle chains that are connected. They're individual muscles, but they're connected to form chains. So with this one, it begins under the ball. This is called the superficial back line. It begins under the ball of the foot, comes through the Achilles, calf, hamstrings, connects to the bottom of the sit bone, and then continues all the way up the back, neck, over the top of the head, and actually finishes here. So you might fall off the pavement and twist your ankle. 6 months later, you've got undiagnosable headaches. in the front. And people will not for 1 second make a connection because, well, that's down there and that's where I've got the problem. When you look at the connectivity of this and how that will impact on the web and the central nervous system, it then starts to make sense. So I've studied the body in a way that makes sense to me from an engineering perspective. And I think what's pleasing for me is, because I've been stuck in a room for many, many years helping people on a daily basis, and it's only some of the veterans that I've been working with, especially in Canada, that really gave me a kick up the backside and said, Chris, I've suffered for years because I didn't know you existed. I'm not really one to go out and promote what I do. I prefer people to find me naturally. So me sharing what I do actually takes me out of my comfort zone a little bit. But I'm on a 5-year mission because I believe we are filling a void. The feedback I'm getting from the other medical professionals is that we have counselling and medication at one end, we have medication at one end, counselling and talking therapies at the other, but there's this huge void in the middle for people who have unresolved physical trauma. And that's really the void that we're trying to fill. So, did that answer your question?
Yes, definitely. Thank you.
Question. A few of my friends have shingles, so that's also connected to the nerves.
Shingles, in my own experience, is very often connected to the liver.
Okay.
An imbalance within the system there. And again, in traditional Chinese medicine, because I've looked at some of the ancient wisdom that exists out there, people are still using acupuncture all over the world. Why? Because it works. Yeah. So I've tried to look at some of the ancient knowledge and find out from an engineering perspective, why does it work? So when we look at the sutures in the bones and some of the most important organs within the body, there's a lot of acupuncture points that line up and start to make sense when you connect the dots. So shingles is very often related to an imbalance with the liver. And in traditional Chinese medicine, the gallbladder and the liver, all the organs work as pairs. And those two are related to emotions, basically. So it's the storehouse of the emotions. So if there's unresolved emotional or physical trauma, and if the system's becoming overloaded, it will quite often manifest as shingles.
Thank you.
I think you wanted to mention.
Yeah, is it your work related to kinesiology, muscle testing, and the history of them?
There is a similarity with the kinesiology in the sense of I'm testing the system, but I'm not using muscles. I'm basically using the mechanics and the fascial response to give me an indicator that yes, that's where an imbalance is. But maybe we can try this if everyone's open to giving this a go.
Yes.
Yeah?
Yes.
If you just lightly place your hands, just relax your hands on the top of your legs and take all the tension out of your neck and shoulders. Just lightly place your hands there so that you feel no tension in your body as much as you can. Yeah? And don't do anything. Just be as relaxed as you can. Check your own body. Check that you've got no tension in your neck, shoulders, arms, that you're as relaxed as you possibly can be. And usually within maybe 30 seconds to a minute, you'll start to feel things in your leg. You might feel the blood flow, you might feel the effect of your heartbeat coming into the system. You'll feel maybe tingles or pulses or whatever it is that you feel. Yeah. Now, with a neutral mind, you're going to feel what you feel. But when you get a sense of what's going on then, when you can feel something, don't rationalize it, don't try and analyze what it is too much, just feel it. But then what I'd like you to do is I'd like you to send your intent. I want you to just think about your right leg. Just think about your right leg and feel what happens to what's happening under both your hands. It will change. There's usually a sense of maybe tightening a little bit, or maybe everything goes very still and very quiet, and what you felt before changes. And if you question your sanity, which I've done many times over the years, you can take your mind back to being neutral. Take your mind away from the right leg, and it will come back again. The pulses, the tingles, the flow, the life, it will return. And if you send your mind back to the right leg, it will shut down, it will tighten. There will be a change in what you feel. Not just under the right hand, but in both hands. It's the connectivity of the web. And this is the significance of adopting an intent in into the system. So when we adopt a bit of quantum physics and we invite an opportunity, if I came along and I placed my hand on somebody's right shoulder with their permission, then that person is not going to necessarily feel threatened by me being there. It might even feel quite nice, but ultimately your inner intelligence, your nervous system is asking the question, what's the purpose of you being there? So if I drop a clear intent into that equation and say, well, how's your trapezius? How's this muscle doing? Before I've even finished the thought process, because the body is picking up on my intent, the inner intelligence picks up on my thought process. This is why it's very important when we're with people. Careful what you think, as well as careful what you say, because their central nervous system will pick up on it. It's very, very important, yeah? So if I suddenly think of trapezius muscle, before I've even finished the thought process, if something needs to unravel here, it will automatically change what they feel and what I feel. Yeah, it's magical. So really, all I've stumbled across after 20,000 treatments and 2 decades of studying the body is by having a little bit of anatomical knowledge, having a basic understanding of the mechanics of the nervous system and the connectivity of fascia. By adopting a clear, distinct intent into the equation, I can get a response through fascia and the fluid production in and around the nervous system. So my questions have to be very specific. I spend my entire session with someone asking questions until the knots that the body wants to unravel have been achieved. And we can usually achieve that within about an hour and a half for the first time that I see someone. And then they're on that 3.5 to 4 month process. Did you get a sense of what happens, what changes underneath your hands? It is very subtle, yeah?
Yes.
It's not some big hallelujah moment. It's very, very subtle, but the effect on the nervous system is phenomenal.
The blood flow that you guys are feeling.
When I had a migraine, you know, I would lie down and she would be very light. You wouldn't even feel her hand, and, you know. But then all of a sudden I would feel like a jerk in my knee or something, you know, like, but my body was so still. I could just feel like my foot would just flex. Or that was a feeling.
Well, I feel very blessed at the moment and very humble that 2 of my old cranio teachers, my upper ledger teachers from 20 years ago, are now actually studying alongside